The producers of Modern Beauty met with Dr. Jay Burns and his wife Jenny at their home in Dallas. Jenny touches on what makes her husband a good doctor and a good person.
The things about him that just make him inherently a good doctor are the fact that he's compassionate, number one. He is passionate, number two, about everything that he does. He doesn't do anything halfway. I think that's a good trait. My husband has character, and good character, and a lot of integrity. And I want that in my doctors, and I think that makes a good doctor. That just makes a good person.
Before practicing in Dallas, Dr. Burns did a fellowship at Harvard, compelling him to work with lasers.
New technology is a big part of my practice. I have a fairly unique niche in plastic surgery. I just am one of those guys that I did a fellowship in vascular. It's a broken road that gets you to where you are, but I started off with this fellowship in vascular anomalies at Harvard to treat children with vascular problems, and I learned about lasers. In that process, for some reason, being the geek that I am, I popped the hood on those things and started learning what they were like, and I knew about them. In 1995, cosmetic lasers just hit with abandon, and I was just positioned to ride the wave. And so I have put myself in a position that I've just gotten, I'm kind of the laser guy. I know a lot about lasers in plastic surgery, and I've written a lot about it. I've spoke a lot, and I was just president of the American Society of Lasers in Medicine and Surgery, which is the largest organization in the world.
Widely recognized for his expertise, his work with lasers is nothing short of amazing.
The hottest thing in the last 2 or 3 years is a thing called fractional resurfacing. So this new technology came in, and it actually treats 20% of the skin at a time to 30%. It's like pixels on a computer screen. You can't see the treatment, they're so microscopic. But in a computer screen, you could take 20 to 30% of those pixels and basically heat cores of tissue to cause a collagen reaction, and it rejuvenates the skin, and it kind of takes, and then it sloughs off. Every 3 days our skin sloughs off, and the brown starts coming off, the skin starts plumping up, and it looks better. And you can now, where you couldn't blend it, now I can go ahead and treat the neck and chest, even the arms and hands, which women have always said, my face is now looking 45, but my hands still look 70. It's a giveaway. We can start treating that as well. So that's been a huge boon to my practice, to be able to treat those patients and get areas we couldn't get before.
Dr. Burns' use of lasers in skin rejuvenation is yet another example of modern beauty.